Hello everyone, my name is Briana Fajardo and the title of my presentation is Caregivers, Salaries and Training in California. For today's learning objections, this presentation gives an overall view of the job experience of caregivers, their day-to-day tasks, wage, benefits, required training, the different issues their employers experience such as low satisfaction rates and high turnover rates, and what to do to improve these rates. All information and statistics provided apply to various areas throughout California. Caregivers are one of the first-line care providers for all people of all walks of life and care requirements. Caregivers are defined by Google as a family member or paid helper who regularly looks after a child or a sick, elderly, or disabled person. There are various types of caregivers. Some work within a facility, others in a patient's home, and some are the patient's very own family. Some specialize in specific diseases and ages, such as autism or dementia, young or the elderly. Others are trained to do certain tasks, like assist in administering medications, while others are not authorized to do so. Being a caregiver also requires various job requirements that are not limited to those that are medical, such as housekeeping, errands, cooking, driving, pet care, and even companionship. Nationally, the demand for caregivers is increasing due to the aging population. While training requirements and knowledge are increasing, salary or hourly pay remains stagnant or near minimum wage levels. Long working hours and low pay contribute to the rising job dissatisfaction experienced by caregivers. Low benefits also contribute to the increase in job dissatisfaction, with only 1 in 5 receiving insurance through their employer, 1 in 8 having dental, and 1 in 10 receiving vision benefits. As mentioned before, the aging population here in the United States is increasing the demand for caregivers. This increase will grow exponentially as more elderly people live longer and more baby boomers near their elderly years. This increase is also due to a better understanding of mental illnesses and the needs of younger disabled individuals. In previous years, caregivers, excluding those that are familial, were trained in only basic care needs such as assistance in activities of daily living. This included the changing of incontinence supplies, feeding, changing of clothes, bathing, and brushing teeth. They were also required to know basic safety precautions, emergency procedures, basic infection control procedures, basic first aid, and CPR. However, in 2014, State Senate Bill 911 was passed requiring caregivers to receive 40 hours of initial training upon hire when working in facilities such as assisted livings, nursing homes, boarding care facilities, or other residential care facilities. Each year of employment, caregivers are required to receive 40 hours of refresher training and be informed of any changes in policies, procedures, and laws. At the end of either training, caregivers are required to pass a test that can be administered in person or online and is approved by the State Board of Compliance for residential care facilities. Training now goes over various topics, including those previously mentioned: admissions, assessment procedures, how to retain patients, dementia care, adverse effects of psychotropic drugs, cultural diversity, sexual orientation and the habits of patients, dealing with families of patients, proper meal preparation, catheter care, and the list goes on. This does not include the 24 hours of training and 16 hours of hands-on training medication technicians are required. Medication technicians or medication aides are caregivers that are certified to assist in administering medications to patients. They are certified to administer sublingual, oral, pre-dosed inhalers, eardrops, patches, and topical medications. They are not certified to administer intravenous or other injectable medications, suppository, and inhalants that are not pre-measured by a pharmacist. Despite the increase in demand, increase in required training and knowledge, caregivers earn a salary or wage close to that of minimum wage. The average caregiver in California earns $24,479 per year, or around $12 per hour. The highest reported salaries are those in San Jose, Los Angeles, and San Diego counties, all of which have higher elderly populations. The salary also includes those who receive specialized training such as medication technicians. Due to the low salary and minimum benefits, caregivers experience low job satisfaction rates and high turnover and employment. Low job satisfaction affects quality of care the patient receives, how satisfied the patient is with the care they receive, leads to higher turnover rates, more use of sick days, more issues with interpersonal relationships with coworkers and supervisors, among other issues that generally occur within the workplace. While salary is a big determining factor in job satisfaction rates, many caregivers knowingly work in the field despite knowledge of low pay. What keeps them coming back to the field? According to a study done in Pennsylvania focusing on job dissatisfaction among caregivers, they found that besides compensation after the first year of employment, other major factors that contribute to job dissatisfaction include the lack of relationship building between caregivers and patients, excessive workload, lack of promotional opportunities and training, and their superiors. Caregivers with less workload are able to form better connections with their patients, leaving both parties satisfied with the care given and received. While adding more caregivers to reduce workload and increasing salaries would be ideal, it is unrealistic in most business aspects. Both would lead to increased costs, which would ultimately lead in loss in profits or increased costs for the patients. However, there are several ways to increase caregiver retention and job satisfaction without large wage increases or increases in staff. According to the New Mexico Direct Caregivers Coalition, providing adequate training, providing better benefits, including more paid sick days, and empowering staff are all ways to improve retention and job satisfaction. Other mentioned strategies include hiring caregivers with prior experience in the field, transparency in the workplace, listening to suggestions they may have, and proper recognition for a job well done. Adequate training is required in any type of job. Thanks to Senate Bill 911, we are closer to achieving adequate training levels for caregivers to give them the knowledge and confidence to handle situations in their workplace without mistakes. This knowledge and confidence leads to less work-related stress, malpractice, and higher levels of patient satisfaction. Offering more sick days allows caregivers to adequately recover from illnesses that are generally spread in their work environment, such as colds and flus. This also prevents workers from coming to work with the illness and spreading it to other patients and coworkers. Empowering caregivers, listening to their suggestions, and providing recognitions to those who go above and beyond help caregivers feel wanted and appreciated. Caregiving is a growing field with high demand but frequently low wages. Because of this, many caregivers experience low rates of job satisfaction, leading to high turnover rates within the field. While raising wages and increasing staff are some of the sure ways to improve caregiver satisfaction, they are not necessarily the only way. Fortunately, there are other ways to increase job satisfaction and reduce turnover rates without increasing staff or wages. These strategies include providing adequate training, providing better benefits, including more paid sick days, empowering staff, hiring caregivers with prior experience in the field, transparency in the workplace, listening to suggestions caregivers may have, and proper recognition. However, we should not limit these strategies to just caregiving positions. As future healthcare administrators, we need to recognize the importance of all employees and apply these strategies to improve their work lives, increase job satisfaction, and reduce turnover rates in all departments. This concludes my presentation, and thank you for your time.